Now then we move on to the mini poster presentations.
Only after the dust settles over an event or process can we see how things were connected. In Lesotho, cases of the deficiency disease pellagra grew after 1933, reaching epidemic levels by 1960. As a historian, I have sought to understand how pellagra was cultivated during this period, a process that involved the effects of drought, maize imports, agricultural policies and practices, and a political economy in which families cobbled livelihoods from small holdings and wages earned as migrant workers in South Africa. I've reconstructed a narrative that explores this constellation of factors. It shows that colonial policies, driven in part by nutrition research, contributed to some positive changes in local practices and eventually to a drop in pellagra. But these same policies neglected and often bolstered the social conditions that supported malnutrition.
So this study looked at understanding the feeding practices of children using a doer-non-doer approach. And in this approach, we looked at enablers of feeding practices and barriers to child feeding practices. And some of the key barriers that we found were social norms and taboos, poverty, unavailability of food, risk to zoonotic diseases, and women's workload. And some of the enablers were income, own production, child spacing, gifts, and availability. I welcome you to poster number 3 for further discussion. Thank you.
This week I was really excited to hear people talk about the spillover effect and the scalability of home gardens, because that's what I've been doing for my master's thesis. And what we found is that women in our home garden intervention are really encouraging their friends and their neighbors to start growing gardens themselves. And so we tried to randomly assess dietary diversity among people who live nearby someone who grows a home garden. We found that women whose neighbors have a home garden are almost 3 times more likely to achieve minimum dietary diversity and 2.5 times more likely to try to grow a home garden themselves after controlling for a long series of potential confounders. And so what that means is that we might be underestimating the efficacy, the effect, and the cost effectiveness of home gardening interventions. Thanks.
Today's cohort of adolescents is the largest seen in human history, and so we're excited to know about how they spend their money, both as we think about their own well-being and as we think about adolescents as trendsetters for other spenders. So we conducted a representative survey of school-going adolescents in Bijapur, India, in northern Karnataka state. We asking them about how much pocket money they have and how they spend that pocket money. We found that 90% of adolescents have some money to spend. Most of it's coming from their parents, especially their fathers. We found that on average, adolescents had about equivalent of about $1 a week. Private school, so wealthier families had more money to give to their kids. Adolescents were spending much of their money on snacks and beverages. We saw no gender differences. We saw that children who were overweight, underweight, and normal weight had comparable spending patterns.
Paper can be motivated from 2 angles. One is the multidimensional nature of food security, which in measurement is quite neglected, and the sustainable development goals. We focus on the SDGs, which are there on the board. And we construct the multidimensional food security using the latest IFPRI BIHS data set, using the Oxford Poverty and Human Development Initiative methodology developed by Sabina Alkire and James Foster. Just to give you a brief highlight of the results, what we find is that Bangladesh seems to perform poorly on dimensions of women empowerment, which are closely linked to food security and diet diversity. We find that regions like Chittagong, Khulna perform the best and Rangpur the worst. And unfortunately, Dhaka and division like Rangpur perform the worst. Thank you.
Working with MS Swaminathan Research Foundation. So my poster is on the impact of nutrition-sensitive agriculture on household dietary diversity. So this is a part of Farming Systems for Nutrition Study and a LANSA research program. So agriculture interventions along with nutrition awareness was provided to have an impact on household dietary diversity. And in the inline, we found that there are changes in the food consumption pattern and in the frequency of consumption. So, do you want to know how? Please visit my poster number 18.
Leafy vegetables are rich source of polyphenol, which provide protective effects against oxidative stress-related diseases. But synthesis and bioactivities of polyphenol compounds are affected by nutrient management during plant production. Previous research has recommended the efficient use of fertilizer through microdosing to reduce food contamination while increasing crops productivity with limited resources. Therefore, our study investigates the effect of fertilizer microdosing on the harvesting time on antioxidant activity of polyphenol extract from traditional leafy vegetables. We get interesting results because both factors have significant effect on antioxidant parameter analysis, and you are invited to visit our poster for more detailed information.
We implemented farmer nutrition school intervention in 2 divisions in the south of Bangladesh from 2012 to 2016, reached over 130,000 women in total. Our direct beneficiaries are women in the 1,000 day range and from the lowest to wealth quintiles in those communities. We followed up with 1 cohort of 400 women over 18 months. Both production and dietary diversity increased, and WDDS increased from 4 to 6 within 9 months of the program and stayed pretty much there after 12 months. So please find out more about our program learning at poster 20. Thank you very much.
We previously found out that there is a selenium deficiency in the northern part of Amhara region. For those of you who don't know about selenium, it is a micronutrient of interest in thyroid metabolism and antioxidant defense. And we demonstrated that the deficiency has a significant effect on thyroid metabolism and cognition of children. And therefore, in order to do the intervention, we did a study by collecting soil and crop samples. And also, we developed a predictive because the distribution was significantly different from areas to areas, that you would find high selenium deficiency in the western part of the area, while there is less amount of deficiency in the eastern part, and therefore we developed a predictive model, and also we developed a predictive model by employing mixed linear modeling, and as you can see, serum selenium and crop and soil can predict each other. Thank you.
This is a social network map of accountability in the policy process for nutrition in Zambia from my PhD work. So this is one piece of data in a study that was tracing the policy process for nutrition and why certain policies get made and implemented in Zambia. So if you'd like to know what data like this can tell us about how different forms of power influence the policy process, and implications for how we advocate for policy change and how we understand the role of evidence in policy, you can come and see my poster. It's number 24.
Rice constitutes the diet of many rural households in Nigeria. However, the supply of rice is constrained by several factors. One of such is post-harvest losses. So our study tried to identify the causes, the stages, and the determinants of post-harvest loss in rice. And we found that the losses are higher in milled rice compared to paddy rice, and it occurs along the rice value chain. So for details, you can check out our slide later. Thank you.
What happens to rural incomes when food prices rise? This is a study of flour farm workers in part of Ethiopia between 2010 and 2014, and that spans a period of rapid food price rise in 2011. Wages doubled during this period, but food prices rose more. Dietary diversity stayed roughly the same, so why? Public interventions were only partial, and it was the private response that was key, particularly in the workplace provision of lunch by flour plantations. Why did flour plantations respond in this way? Because they were worried about labour turnover in a tightening labour market. Why did they provide lunch themselves? Because they said it was more cost effective than raising wages further, and it was tax efficient. Importantly, they could control who ate the food.
Our study aims to see the relationship between seasonality and dietary intakes, mobility, and nutritional status of children aged 6 to 23 months. So previous studies used short-term cross-sectional studies, which is just showing the snapshot of the seasonal variation. However, we use 5-year-long longitudinal studies. Thank you.
In Kenya, 80% of the population depend on the informal markets for livelihoods, income, and nutrition. At the same time, the governments are more and more worried about public health and whether there might be risk about consuming raw milk. And there is a formal sector which is small but is very strong, and it wants to get an increasing share of the dairy sector in the country. So with this combination, there's more and more pressure on the informal markets, the raw milk markets, towards banning them and repressing them. But we think that can have some impacts in the livelihoods of people, but especially on the nutrition of poor households. So we did this study in peri-urban Nairobi to see what will happen to the milk intake of children in peri-urban and poor households in Nairobi. Thank you.
Our poster reports on a project which aims to make biofortified beans more affordable and accessible to communities. The research draws on the combined theory of plant behavior, health belief model that is shown on the slide. Our study found that individuals who were perceived iron deficiency and anemia to be serious health problems were more likely to consume biofortified beans. The implication is that equipping individuals with information they need to make healthy food choices can make the most impact on diets. Our project was funded by the Bill and Melinda Gates Foundation.
As you know, the consumption of quality protein maize in the control setting has shown some positive effect, especially on children. While the quality protein maize as well as the biofortified crop promoted in Ethiopia as well as in other countries, there is no studies that look at the consumption as well as the promotion in a very natural setting. So in summary, we found that adoption of the quality protein maize as well as the biofortified did not change any area in terms of production. And further, we found that there was no significant difference between treatment and control based on our intention to treat analysis in both primary as well as secondary outcome, which implies that a multiple-year intervention needed to understand how biofortified crop production as well as promotion would bring nutritional effect.
My work actually builds on a lot of our colleagues here who have argued that gender inequality and land ownership are some of the major disconnects in the agriculture to nutrition pathways. We argue that livestock transfer interventions actually have the ability to overcome a lot of these disconnects. As we know, livestock is a very dynamic asset in the rural economy. It's important for income, it's important for consumption, but more importantly, it's considered a woman's asset. Our survey found that women say that they own livestock and that they manage it, but they have no say in the income that comes from it. So really the argument that I want to highlight is that we really need to do a lot more through design and implementation of agriculture interventions to improve women's ownership and legitimacy of existing assets such as small livestock and expand their property rights to larger assets such as land and large livestock.
The Ministry of Agriculture has developed this strategy to ensure that the agricultural sector in Nigeria becomes nutrition sensitive. And so, following the launch of the strategy, the ministry initiated activities to train this government staff who will be leading the implementation of this strategy. So they are the ones who will be guiding other actors in the agriculture sector. But what we found was that the knowledge gaps of this staff are so wide. For example, we did a pre-test for some of them, about 15 staff, and only one person knew what food groups were. So if you want to know more about our findings, you can visit us at poster 43.
So MAFA is a participatory agriculture program that trains mentors to mentor other farmers in nutrition, gender, and sustainable agricultural practices. So we found that with MAFA, we saw a significant difference between MAFA and non-MAFA participants in crop diversity and household food security. And then we also saw association between crop diversity and childhood intake of vitamin A-rich foods, which included local orange maize, which we found had the same amount of vitamin A as biofortified other products, and then also white and orange maize. If you want to find more, visit my poster at 45.
We talked a lot about the benefits of animal source foods here this week, but we also know that chicken contamination can be harmful for a child's nutritional status. So as part of the Atonu Agriculture to Nutrition study in Ethiopia, we look not just what households are currently doing for their chicken management practices, but also use qualitative methods to look at why they're doing it. So you might guess that having a chicken coop would be associated with reduced exposure to contamination, but the answer might surprise you. So if you agree that large household surveys are great, but are way more powerful when they are combined with qualitative and multiple qualitative methods, then I invite you to visit me at my poster, where we look at a large household survey of 2,100 households in rural Ethiopia, as well as in-depth interviews with caregivers and direct observations. Thank you. Poster 46.
We looked at the food choice motives in urban Nigeria, and these food motives provide valuable information and insights on underlying choices that people make when they're making their food choices. And these food choice motives are measured with the food choice questionnaire, and this is a questionnaire that we mainly use in developed countries, and it's validated and extensively applied over there, but not in low and middle income countries. And therefore, we aim to validate and extend the questionnaire that it will fit more in the local context, for example, of urban Nigeria. So last year we conducted focus group discussions in 4 cities across Nigeria, and collected really interesting results on the motives that people have. And one of the main motives is related to health, and I'm more than willing to tell more about these motives that we found. Please, to number 49.
BNNC, the Bangladesh Nutrition Council, has recently been revived in Bangladesh to coordinate nutrition programs and expenditures across 17 ministries in Bangladesh. So we will look at the national nutrition policy and do a public expenditure review of the nutrition finances in Bangladesh. And we use different thematic areas, but also a 3-step approach to identify which projects are nutrition sensitive and specific, and how they could potentially be leveraged in Bangladesh to produce better nutrition outcomes. The results are in my head, and so if you want to know a little bit more about that, come to 5858 in the other hall.
We had 70 studies from 21 LMICs. 70% of them were from upper middle income countries, 26% from lower middle income countries, and shockingly no studies from LICs. So studies were quantitative, qualitative, and mixed methods, although quantitative featured was the most common. Cross-sectional designs were featured heavily. Methods include stakeholder-based, market-based, and also GIS-based. And availability was the most common dimension that's been investigated, with other dimensions that have not really been addressed so far. So results were synthesized in terms of the outcomes. These included food environment outcomes, dietary outcomes, and health, as well as studies that included both. So if you want to know more about food environments in LMICs, or you just want to come for a chat, I'm at poster number 60.
And we have followed 40 Ghanaian farmers, male and females, for 4 weeks across an agricultural season to answer a simple question. Can we use technologies embedded in wearable devices, such as Fitbit, to get a better understanding of energy requirement for farmers in low and middle income countries? We think that the answer is yes. If we triangulate the information that we get from accelerometry devices with time use and food intake data, we can actually get to know, to have a very reliable profiles of energy expenditure for farmers. My name is Giacomo Zanello, and if you want to know the answer of this question, you can come to the poster number 63.
In this project, we're developing a systems approach, trying to understand the diversity of food choices in Eastern India. So we really have been digging into what are the occasions, what are the dishes, what are the ingredients that go with certain dishes and certain occasions to really understand why do people eat the food they eat. And so we've got some very interesting results, which you can already see at the poster. But the more interesting part is still coming in the next phase of the project, where we're going to develop an app now, an app that we can elicit food choice among consumers and households with a very strong gender approach to really find out how can we nudge households in Eastern India towards more healthy food choices. So you're very welcome to join me at my poster at 44.
My poster presents the results of an independent external third-party evaluation of the USAID-funded Yagende project in Senegal, which successfully achieved combining a set of nutrition interventions and a set of agriculture interventions to reduce stunting and wasting and underweight prevalence. We succeeded in reducing stunting by 30% over almost 7 years. We have now just started, about 10 months into a follow-on project now with $40 million in Senegal, where we're aiming to impact 285,000 households to further reduce stunting by 30% and impact 2.8 million lives. If you'd like to know more, come please get your kicks at poster 66.